All right, let's talk about discrete haircuts and hiding your procedure such that no one will know you had it after your acute recovery phase, the 10 days after your procedure, where everyone kind of has, bandages, a little bit of nappy hair. After that, you want things to be relatively well hidden. And this is how to hide the donor site. Okay. Now, a lot of people will go out there and hear the no shave technique, the pick and swallow technique, the discrete method, which we developed using micro. These are all ways of just hiding your procedure, which is actually your ultimate goal, right? Now, there are limitations to the discrete procedure that we created, and it's because the limited visibility. We don't cut the hairs at all. We just kind of use our fingers to push the hairs away. We find a hair we want, and we go after it. We core it out, and since we're not using rotation, we're not getting hairs tangling it. We use vibration using micro. We're actually able to get the hair out in a method that requires no haircut whatsoever. However, we're still working through a forest. And finding the hair that we want is very difficult. So if you want me to create you a nice feathered hairline with nice single-haired feathered grafts, and I go in there and I try to get one of those, and it's actually a 2 or 3 hair graft, that's not looking at your hairline. And all of a sudden, I just sacrificed a 2 to 3 hair graft that you might want in the future. And it wasn't the best technique for that. It was great for overall hair restoration or mid-scalp restoration where you had a combination of hairs you want to use. But in creating the hairline, our technique admittedly didn't work well. Neither does no shave, neither does all these pick on the methods. They don't work in the right scenario. Actually, what you need to do is just create about the haircut. How many grafts do you need? Can you pre-plan how many single hairs you need? Can you pre-plan how many double hairs you need? Can you do a low fade? Can you do a medium fade? Or do you have long enough hairs where I can just kind of pick up a strip here and I can buzz a 1 centimeter area and then get all my hairs out of there and do that in a couple spots on your head and no one ever knows? Are you a female who has longer hairs and I can put one at the lower nape and one at the upper nape, and we can actually use a hairstylist during the morning procedure, and we think we can really just kind of get as much exposure as we can to get the hairs we want at the same time as creating a nice concealed procedure. That's what a discrete haircut is, in my opinion. It's doing whatever we have to do to accomplish the same end goal, which is a beautiful result that's uncompromised 1 year, 10 years down the road, and concealing the procedure today. Now remember, a discrete procedure does not conceal the recipient site. We still put in these little specks of hair. They grow scabs on them, and at 10 days, and up to 10 days, they're visible. At 10 days, we wash them out and you get these little stubbles of hair. Well, if you're advancing the hairline pretty far forward and these hairs cannot cover it, then the recipient site is still visible and you don't really have a discrete procedure. That's why hairstyling plays a very big role in your post-procedure. I will advise you on how much you can advance that hairline and what hairstyle you should wear. You can work with a hairstylist to actually get that ready before your procedure to conceal the recipient site as well. Or we can deploy our next technique, which is called long hair. We actually transplant the full length hair, and that full length hair stays there until things shed, and then everything kind of looks normal during this entire process. So we have discrete haircuts for the donor site we're getting hairs from, and we have long hair transplantation in another video, which we can use to conceal the recipient site. The limitation here is always a long-term result, and we don't want to sacrifice that. I will tell you when these techniques are not a good idea.